Just to the show, Doctors Lynda and Crystal Dean Duru are leading the way in Ashburn dentistry, and they are taking pride in themselves for being leaders in pediatric dentistry as parents who travel far and wide to address everything from mouth breathing to sleeping issues to tongue ties in their infants and children. Welcome back, doctors. You guys just do everything. And like I said, when I visited with my family, I'm like, they asked me where we were from. I'm like, we're local, but no one else here is. Everybody travels from far and wide to see you all, and I know exactly why. How are you all both doing today on this beautiful Friday?
Quite well.
Happy Friday.
I'm so excited to have you all here, and I wanted to start off with, what's the #1 reason people come to see you? Because it's not just, oh, I need a teeth cleaning. It's so many different things.
So, like you said, it's a full variety. From infancy, if moms are having trouble breastfeeding, or their child is just not, latching as well. For toddler and older kids, it could be crowding, it could be snoring, mouth breathing, just things that parents are noticing that oftentimes they've been ignored about as being important, and so typically they'll be there for a variety of reasons, but it does range from mouth breathing, snoring, crowding, crooked teeth, behavioral issues, things like that.
And we're going to get into that. You guys are coming back because it's so interesting to me, and I always say I always learn every time you guys come here. So I want to ask Dr. Lynda, I brought in my infant, and we did an exam on her, and I think we have footage of it. Tell us what went into an exam for an infant, because I know a lot of people that's new to them, an infant exam of their mouth.
Absolutely. And so when you came in, obviously, besides my dancing in, welcoming the baby, as I was doing that, I was actually watching her to see what she was doing, where her lips together, where her fists clenched. How was she sitting? Was she comfortable? Because that tells us a little bit more about what happened during her birth. And so when that happens, now I take her and I put her head toward my belly so I can actually look in from inside, and you could see what was going on. And then we'll check to see how is she laying down, how does she respond when we try to hold her hand. Those are kind of looking for the reflexes before I even get inside of her mouth. And then I look to see, she's swallowing properly, is she sucking properly, what is she doing when I put my finger in, as you see me putting my finger in, so I can watch to see what she's doing with that. Because all the tongue function determines how well you breathe, how well you sleep, and how well your face grows.
It's mind-blowing. Cool. You see me and my husband are just learning, like students of life. And you brought in a bottle, and let's talk about, most people when they're buying bottles, I have a lot of new moms calling me, like, Sharice, because you've done it now. I'm like, I'm not the expert. Dr. Lynda knows. What should we be looking at for nipples of bottles?
So when sometimes breastfeeding is not possible and you have to use a bottle for whatever reason, what we like is a bottle that doesn't have a restriction so that the baby is using their chin instead of their tongue. So you're looking at one that flows evenly and has a broader base, because ultimately the goal is to have the baby's lips be on this purple part to it. So if you look at it, there's not a stop here, because if there were, her jaw would have stopped here and she'll be using her chin to kind of push the milk. That's a lot of force. That's a lot of using all the muscles that she shouldn't be using. She should really be using just her tongue. The back portion of your tongue is really what's important. So many times when people say, oh, they can stick their tongue out, that's not the motion that is important for growing your face. And so that's why it's important to look at the kind of bottle you have. Some people have one that is really skinny here and then has a broad base. The baby can't just get all of that inside their mouth, because you're still looking, because the action of the tongue pushing up on the roof of the mouth is what helps the jaw to grow. So we're trying to lay a good bunny foundation so that we have less braces, because I know every mom is ready for braces, but we should be asking, why are the kids needing braces? If we can set the foundation right from the beginning, they'll grow a good bunny base, and the teeth will come in closer to where they're supposed to be.
I always learn so much, and ladies, I always tell you that people are excited to come see you. Let's talk, we have a graphic. You guys are doing Spirit Week for Halloween, so it's so much fun. So why is that so important, just to have that fun atmosphere?
Oh, well, Number one, I love dressing up for Halloween, so that's just me bringing my personality to the practice. But we've always done it throughout. It's really just important to get everybody involved and just enjoying this time period and letting go. And we're almost all together, just having fun, dressing up. And,
I love it. I'm popping up next week. I'm popping up.
Come out, girl.
Look, don't tip me with a good time. I'll come back and bring the baby too.
Oh, absolutely.
And if you all have any questions for the doctors, you can go to our website, livinglocaldmv/growing healthy faces, and they can answer their questions live on air. So ask your questions. The doctors have the answers. Our professors, our doctors, the dynamic duo. Ladies, thank you so much for joining us.
Well, thank you so much. It's such a pleasure.
It's always a pleasure. It's too much fun, honestly. It's too much fun.